Hello, I'm Lillee Gelinas, Editor-in-Chief of American Nurse Journal. We're here today to have a discussion with Editor-in-Chief Emeritus Pam Cipriano. Pam is the president of the International Council of Nurses. She's also a professor at the University of Virginia. Pam is also co-chair of the UHC 2030 Steering Committee. Welcome, Pam. We're here to discuss the ICN report, The Economic Power of Nursing, the case for nursing. So Pam, start us off here. Introduce us to this important report.
Thanks, Lillee. This year for International Nurses Day, we chose the theme, Our Nurses, Our Future, the Economic Power of Care, because we know nurses have been undervalued for a long time. And we believe that nurses need to move from being invisible to invaluable. And one of the best ways we know that we can do that is to demonstrate their economic value, as well as what we know is life-saving value and the contributions that nurses make to the health of individuals around the world. But what we also know is absolutely critical is looking at the value that nurses bring to the economies of the countries all around the world. We know that right now, poor health, which is the byproduct of so much of the care that we give around the world, is a drain on gross domestic product globally of 15%. We know that if there were investments in nursing, that we could boost the gross domestic product globally of 8%. Now, how do we know this? This report has engaged a number of world experts in economics as well as nurse economists, and we've looked across a number of subjects to really look at what's important in terms of restoring the nursing workforce that we know is essential, having sufficient numbers of nurses everywhere to be sure people can get the care that they need, as well as making sure that we are focusing on the priorities that will restore health and healthy people so that we have healthy economies. For example, one of the global goals of the United Nations and the World Health Organization has been to achieve universal health coverage. And in that, we know that we need to provide quality care across the lifespan, where and when it's needed, then making sure it's effective and not pushing in people into poverty. We can only do that by investing in nursing. We need more nurses to be delivering primary health care. That is a major solution to not only addressing some of the serious concerns about chronic diseases, but also keeping people healthy. And we know that if we were to be able to achieve the goals of universal health coverage, together we could save 60 million more lives and add 3.7 years to life expectancy. So there are many benefits that we have outlined in this report to speak to country leaders, to ministers of finance, as well as ministers of health and ministers of foreign affairs, to understand the connection of investment in nurses and the health of their people, the health of their economies, because we know that when we have productivity and health, we have economic growth, we have job creation, we have productive gains across a number of sectors in our countries. And so that's why we are so invested in making sure that countries know their responsibility to invest in nursing.
You know, Pam, the International Council of Nurses is a federation of more than 130 national nurses organizations representing millions of nurses worldwide. Just tremendous reach, such powerful words. But at the end of the day, why should everyday nurses care about the report and the results?
I really hope every nurse recognizes that the work that we do at the International Council of Nurses, as well as through all of our members, and the U.S. member is the American Nurses Association, is focused on strengthening the nursing profession, as well as making sure we have good global policies for addressing health for all people. So we want all nurses to be aware of this report because we continue to recycle the same issues. Nurse staffing is fundamental to everything that we do, whether it's in the community or in the hospital or in ambulatory care settings. We know that that's been an issue that all nurses care about, and it is central to the recommendations in this report. we not only have to have a sufficient number of nurses, and we have, again, laid out what the needs are for general health purposes, for increasing our ability through primary care to have universal health coverage, but also the needs of a healthy workforce. We know in order to re-recruit individuals into nursing and have that next generation of nurses that we need to have healthy work environments, because again, the equation makes absolute sense. When we take care of our health workforce, when we have a healthy work environment, we are able to retain as well as recruit nurses into the workforce. Without that nursing workforce, health suffers. It also affects our ability to be prepared for epidemics and pandemics and be able to reduce the unnecessary deaths that we see. So there is something in this report for every single nurse to recognize and see themselves in terms of their role and their contribution to their own health system, and give them the knowledge and the data, obviously the evidence, to say, it's important to invest in me, it's important to invest in the nurses in our country, because we can help our economies be stronger, to have a healthy workforce, not just in healthcare, but a workforce across all industry sectors. There's a few sayings that I think are important that I'll share. I can't remember exactly where I heard them from, but it's that healthy adults earn. So we know when we keep adults healthy, they are productive in the workforce. But also important is healthy children learn. So we need to keep our children healthy so that they can optimize the education that they have and they can go on to be productive adults. So I do believe there is some data and evidence in this report that every nurse can identify with, and we want them to take that information and be able to influence the investments in nursing no matter where they live.
Build on what you were just saying, especially to the point that investing in nursing is an accelerant for global growth. But a topic near and dear to every nurse's heart is staffing and the nursing shortage. So what does the report say about those two important topics?
Yeah, I would emphasize again that staffing, you may not see the word staffing per se as the key activity within this report, but it is all part of having a strong and healthy nursing and healthcare workforce. So this report, it reinforces the fact that in order for us to have healthy health systems, we need to be able to ensure we have healthy nurses and healthy work environments. We know that it is nurses that are the key to strengthening our health systems. And so that, again, what that means is really looking out for retention of the staff that we have, as well as making sure that we are continuing to replenish that workforce. Estimates have really spanned from 6 million to 30 million additional nurses are needed worldwide over the next 6 to 10 years, which is a daunting number. So we know that we have to really look carefully at what we're doing in order to be able to have a sufficient workforce. In the United States, we are very fortunate to have very robust staffing in many of our locations, or most of our locations, even though nurses always believe that they want to see more resources and to be able to provide the very best care to get the very best outcomes. But we also know that it's important to recognize that we want to create decent jobs and decent work, which is unfortunately not the case in the United States. We do have decent jobs. We do have good salaries. We do have protective policies. But in many other places around the world, again, some of the emphasis of a report is to say we have to have decent work. We have to have policies within our workplace that keep people safe, that deal with gender equality, and also, again, make sure that we are protecting nurses so that they are satisfied and know that they can do the work that they are intended to do within their workplace.
You know, Pam, building on that, I want our audience to know that the data in this report is profound, broad-reaching. As a nursing leader for over 35 years, I sure wish I had some of this data when trying to make a business case for nursing to the chief financial officer. But there's a line in the report, I want to emphasize what you just said. Based on the data in this report, to reach just 80% of the optimal nursing coverage ratio, there would need to be an additional 30.6 million nurses in the workforce. really long way to say we've got to invest more in nurses. What are some of the other benefits for that we need to know that came out of the report for society overall and not just nursing?
I would emphasize again that one of the whole reasons we have done this report is to make the clear link between healthy economies, a healthy general public workforce, and the reason that we need to invest in nursing. So again, we know there's a lot of preventable deaths that happen around the world. We know by boosting the number of nurses that are working in primary care and achieving universal health coverage can save up to 60 million lives. That is really critical. And again, we see the benefits accruing on a much larger scale to low and middle income countries. But that doesn't mean we don't have our work cut out for us to do in the United States, because we do have pockets of poverty. And it is poverty that is the drain on people's health and well-being. So we know that when we invest in nurses, we are investing in the infrastructure of the country that allows us to keep people healthy and to be able to improve their quality of life. It could be everything from getting them the medications they need, including vaccinations, to making sure there is a system that checks up on individuals that have health conditions, or again, the teaching about how to stay healthy, how to eat healthy, how to do all of the things that we know are part of a strong public health system that over the years in many places has eroded, again, due to lack of funding. But right now we know it's fundamentally important to act on these shortage projections, because we can't address some of the chronic problems and barriers we have in helping people be healthy unless we can address these workforce issues. So it is making that clear message of why it's important to invest in nurses that must go to the highest level of governments. Many countries, their positions are funded by the government. Their health care is paid for by the government. For us in the U.S., it's convincing our employers and our insurance companies to think together collectively about how important it is to look at nursing as an investment and not a cost. We have to embrace that health is a human right, and the way we can deliver on health is to invest in nursing. It's too easy for organizations to say, oh, we need to trim our budget, so we're going to trim our workforce. Nurses are the largest part of that workforce. We're going to cut those positions. That is the absolute wrong, backward direction. And so we believe it's important, once again, that nurses raise their voice to be able to bring this evidence to light everywhere to demonstrate the true value of nursing and nurses across the entire spectrum of where we provide health care.
Can you talk in the report about the challenges of nurses being able to practice at the top of their license? We know that's prevalent here in the United States. Is it a global problem?
Full practice authority in the United States focuses predominantly on advanced practice, but we are seeing more and more that we want all nurses in every setting to be able to practice to the full extent of their education, certification, all of the ways in which we demonstrate their expertise. Because we know all too often nurses have to substitute for other roles if they're eliminated, or to be able to fill in the gaps, and that's an underutilization of their expertise. We've seen in surveys over the years that up to 80% of nurses, and this includes physicians too, say that almost half of their work someone else with lesser qualifications could do, and they're very supportive of having other team members to do that. So we do want to look at optimizing full scope of practice for every nurse, and that is true around the world. We are seeing that once again in other places where budgets have been cut, supportive positions have been eliminated, and so we want nurses to spend their time really using their intellectual skills and their ability to problem solve and be able to deliver care to a wide community or highly technical environment, doing all the things that nurses do no matter what the setting, rather than believe that they are restricted. We also see some restrictions that are placed by other disciplines, as well as some of the restrictive laws and conventions in certain areas. So part of our plea is to recognize nurses are highly educated, they are great problem solvers, they want to be able to practice to the full extent of the knowledge that they have. Otherwise, they not only feel underutilized They feel unfulfilled because they're not able to provide the range of services that they know are essential to their patients and communities.
Essential to filling the nursing shortage in many different ways and closing the care gap, as I call it. You mentioned change many times. Can you introduce us to ICN's Charter for Change? I'm excited about that.
So back in 2023, our International Nurses Day theme started with Our Nurses, Our Future. And because we had learned so much during the pandemic about needing to protect our workforce and really support our nurses, we brought forward the message that we need to value, protect, respect, and invest in our nurses for a sustainable future for not only nursing, but healthcare. What we did is we put together our Charter for Change, which is 10 policy actions that we want governments and employers to put into place in order to be able to do that, to protect and invest in the nursing profession for a sustainable future. So the 10 items address, again, protecting and investing in nursing to rebuild and strengthen health systems, to address the support needed for the health and well-being of nurses, improving their working conditions, to aggressively recruit and retain nurses across the workforce to address shortages. We also issued a directive to implement and finance national nursing workforce plans. If countries don't know the nurses that they need, then they may not be aware of the gaps that they need to fill. We also proposed investing in high-quality accredited nursing education programs. There is great discrepancy around the world about the duration of programs, the competencies, and so we feel it's important to address that globally. As we just discussed, we want to be able to enable nurses to work to their full scope of practice. And we also are calling for recognizing and valuing nursing skills, knowledge, attributes, and expertise. We have to understand and respect how well educated and how capable nurses are, involved in the decision making at all levels. We also have proposed much more meaningful engagement of our professional associations. That's where policy can change. That's where the voice of every nurse can be brought to the highest levels of government. Also, something very common in our nursing messages, protecting vulnerable populations, upholding human rights, working for gender equity and social justice. These are fundamental to the ethical and moral decisions and values that nurses bring to their care. And the last item in the charter is to appoint more nurses in high-level leadership positions across government and healthcare organizations. We need the voice of nurses to be part of strengthening all health systems.
Well said. Do you have any concluding remarks about the report for our audience that you want to make sure they know and get excited to read it?
So in addition to the evidence that we've presented clearly about strengthening economies, looking at nursing as an investment and not a cost, there's just a couple other things that I think are worth highlighting that I hope everyone will read the entire report and come away with. And the first is that, again, investing in nursing has a cascade effect across the economy, across the issues of society. And so it is a key and accelerator to social prosperity. The other piece that may not be apparent but is so critical in our world today is that when you have strong economies, when you have healthy people, when you have the relationships that individuals will trust their government, trust their healthcare systems, it is also an accelerant for peace in addition to prosperity. We need more peace in today's world. And so we also view nurses as peacemakers. Investing in nurses is wise for so many reasons that we have outlined in this report. And we're so pleased to be able to offer this to nurses around the world, once again, to strengthen the discussions in their own places of work or with the highest levels of decision makers in their country, to be able to bring home that message that as we embrace health as a human right, we must invest in nurses and nursing to be sure that we are seen as invaluable and are no longer hidden behind the curtains in the wings as invisible. It is time for nursing to be recognized, respected, and valued.
Thank you, Pam, for your tremendous leadership, which you have shown the profession for many, many years. And we're so grateful that you're at the helm of the International Council of Nurses, where you have leadership responsibility for millions of nurses, but I am very, very confident that at the helm, you are going to be instrumental, in your words, from taking nurses from being invisible to being invaluable. I want all of our audience members to click the link that's in this particular discussion where you can read the full report. You can download the report in PDF format, and you can also listen to the full webinar back in May, which Pam referenced, which formally introduced the report to all of us nurses around the world. Thank you for joining us. Goodbye.